My name is Chetanjit. I'm a community psychiatric nurse and I'm based at Handsworth and Ladywood Community Mental Health Team. So I started with the Trust back in 1992 and I've been here ever since. That's 32 years. And my current role I've been doing for the last 29 years. I work with adults of working age, so people, service users who have severe and enduring mental health issues and complex needs. What I love most about this job is the day-to-day contact I have with service users and their families. I see people making progress towards their recovery and achieving their personal goals. I also enjoy looking after students and being part of their education. So not only sharing my skills and knowledge and expertise with them, but also learning from them and shaping the future generation of nurses to come. I've been nominated for a Lifetime Achievement Award and it means so much. It's a huge, huge accolade. It makes me feel very humble and honoured and privileged to have been nominated for this award. So to the person who nominated me, I'd like to say a very special thank you for taking the time out to do that. Thank you.
My name is Dave. My official job title is Senior Clinic Nurse and I'm based at Small Heath Health Centre over in East Birmingham. We work to support the CMHTs and the care coordinators within the CMHTs. So we're looking at the management of clozapine, blood taking around that, medicines management and associated health monitoring. My journey in the Trust began a long time ago, before it was a Trust and when we still had area health authorities. And I started my nurse training here at All Saints, as was, before Mary Seacole was built. So I've been lucky and I've been fortunate in terms of the career that I've had. I've been involved with teaching back in the day and this whole movement from the institutionalised hospital care that I began in back in the mid-80s through to this community orientated service that we are looking at now. Some of the things I particularly enjoy about working in the Trust is that sense of continuity. As I said, working in this organisation for a long time, I've seen it grow and develop, I've seen individuals grow and develop. So yes, for me the best thing is that sense of continuity going back almost 4 decades, back to those people I learned my skills from. Thank you for considering me worthwhile or sufficiently worthwhile to be nominated. But if it brings some awareness to the way that we operate mental health services, to the way that people perceive mental health services in the city, then that's a good thing. Thank you, Mary, for the nomination.
Dr. Robert Wall trained in medicine at the University of Birmingham, then went on to higher training in psychiatry, becoming the youngest consultant psychiatrist in the West Midlands in 1982. He joined the then North Birmingham Mental Health Trust and has served out his entire consultant career in this area. Dr. Wall has always enjoyed having trainee doctors to teach and supervise and is a keen advocate of good multidisciplinary working, valuing other members of the team such as nurses, psychologists, occupational therapists and pharmacists. Dr. Wall's taken on additional medical and clinical leadership roles, including that of the Chairman of Division, the Chair of the Medical Advisory Committee, the Acute Care Clinical Director and the Divisional Medical Officer. Despite this, Dr. Wall has remained very much a hands-on and grounded clinician.